It was started by Phyllis, who actually had a daughter who had EB, and at the time there was nothing, done about EB. DEBRA is the UK national organisation that looks after people with EB. We are non-medical, so we liaise on a daily basis with the nurses from either St Thomas's or Gosh for the children with EB, and we do home visits, we do joint visits with the nurses, and we try to put all our efforts together to come to a solution, or if there isn't any solution, to work towards a better life for them. We help them filling out, forms. Sometimes we need to help with their housing matters as well. We've got complex cases, so they might need help with their counsel, so we try to interact and help them with counsel. I've recently had a lady who'd split up, with her partner, and she needed help with legal advice. So we are not legal people, but I needed to guide her towards, a legal advisor for her to get a better answers. We have got a lot of events organised, for next year. So that's one of them. That's Members Weekend happening in May. Where all our members are invited with their families, which gives them the opportunity to get to know each other. And there's different stalls as well, talking about dressings, about wounds, etc. So that's a very, very good one. We are emotionally involved as well. People suffering with EB are emotionally involved. So we're the first port of call. So we need to try to manage that as well. So we refer back to doctors for counselling. We come to St Thomas's as well.
The main users of the unit, so epidermolysis bullosa and xeroderma pigmentosum and Bardet-Biedl syndrome, are all disorders that are funded centrally through the National Health Service in the UK. And because that money comes centrally and we're specialised centres for those diseases, it means that all of the specialists that you need are part of the service and they're all funded within that. We're very fortunate in the way that the NHS is set up to be able to provide that. I'm sort of very aware that in a lot of countries it's more difficult. It has to be more piecemeal and build up organically, so maybe a doctor to begin with, and then you get a nurse, and then maybe more doctors and therapists come along, and things can grow organically. And it can't be underestimated, the benefit when you're dealing with complex rare disease. You really need to have all the different players feeding in together.
Connection, the networking is very, very important, because we're talking about a medical issues there. Very important to be able to go and talk to the doctors and the nurses, and they're all very, very busy people, but that connection altogether is really, really important. We have to sometimes liaise with the GPs, so GPs can refer back to St Thomas's for the referrals. We also talk with statutory services like the DWP for the benefits. We talk to social services as well. We talk to the schools as well. So we talk with a lot of statutory services, because we sometimes need their help as well, and they do need to be involved. DEBRA is covered all over the UK. We work according to postcode, so that's Team South and Team North. And wherever you go in the UK, there'll always be a community support manager. This is not the job that a nurse or a doctor can provide. So we, as community support area managers, we're trying to do that for them.
I think if you can get patients and families engaged, that certainly adds to the power of what you can bring and offer, and also to be able to lobby your government or your health service to have that combination of patients, clinicians, also if you've got patient organisations, to come together and do that. So I think a multi-pronged approach to try and establish things is probably the best way.
It's very, very important that we can all liaise together to get, a better answer and find the best solution going forward for the patients.